Welcome back to Ronnie, I'm Joe B. Today I'll show you how to correct a pelvic inflare through muscle energy techniques and exercises. Let's dive in. Pelvic or iliac inflare is when the ilium gets stuck inward. The cause of this can be due to repetitive cutting and excessive iliac internal rotation, hip internal rotation, or toe-in mechanism of injury, which can result to the anterior superior iliac spine, or ASIS, to be more medial on that side, the right lower extremity toe-in during stance in swing face of gait, right unilateral sacral flexion, and since the lower lumbar spine stays in neutral, it would seem like it rotates to the right. Iliac inflare or pelvic inflare can bring about low back pain below the belt line in a rectangular pattern. Running, walking, and stair climbing can increase it. More importantly, the patient will feel that one foot is in a toe-in position during walking. The assessment for pelvic or iliac inflare requires the patient to be in supine with arms at sides and feet at a hip-width separation. The therapist should be at the foot of the table on the tested side. From there, the right hip is laterally rotated passively, moving the foot away from the body's midline. Normal findings is that the end range lateral or external hip rotation will have a firm end feel or a feeling that you are pulling on a rubber band and that you are able to pull towards toe-out position. Abnormal findings of a positive pelvic or iliac inflare is when the hip is felt to suddenly stop or a hard end feel, halfway the toe-out or hip external rotation total range of motion. To treat, let's assume that the right side has the pelvic or iliac inflare. The patient assumes a supine position with the treated ilium close to the edge of the table. The hip and knee is flexed such that the right heel is either on the left tibial tuberosity or distal anterior thigh, if uncomfortable, at the tibial tuberosity since it's a bony prominence. The therapist will be on the treated side. The right hand will be placed on the patient's medial right knee, while the left hand is placed on the left anterior superior iliac spine, or ASIS, to stabilize the pelvis. The therapist externally rotates the right hip until a limitation of movement is felt. Patient is then instructed to rotate the hip internally or medially against the therapist's resistance for 6 seconds. Then the hip is further moved into lateral or external rotation, and the process is repeated for 5 reps, moving further and further into the end range after each rep. Hook lying, bent knee fallout exercises can be provided for the patient to reduce or eliminate the likelihood of iliac inflare recurrence, since this exercise promotes iliac outflare, hip lateral rotation, and unilateral sacral extension, all to reverse pelvic inflare mechanics. This is performed for 2 sets of 10 reps. You can also progress this to a bent knee fallout stretch for 3 reps, 30 seconds each, by pressing the medial knee towards the bed, with the right hand going further into hip abduction and lateral rotation as tolerated. So do you want to know how to correct a pelvic outflare? If so, then watch this next video. Thank you so much.